Welcome, everybody. We're going to get this webinar started. Thanks for joining us. Here is Dr. Mark Jewell and Dr. Robert Singer.
Well, good afternoon, everyone. Good evening, or wherever you are in the world. This is the first of a series of webinars that the Aesthetic Society has asked us to give with regards to the matter of the COVID-19 pandemic, and it's entitled, "What Am I Supposed to Do Now?" I'd like to turn it over to Robert Singer, who is our co-moderator, for some opening comments.
First of all, we'd like to welcome all of you. Mark, Mary, and I, for many years, have been on a practice management symposium and course at the Aesthetic Society, and we felt that the organization needed to answer many of the questions that all of you have. So I'm very happy that they decided to proceed with these. If you look at the aesthetic arena, the Aesthetic Society has taken the initiative to lead with information, as it usually does, to help our members, other plastic surgeons, our patients, the public, and the media. Before we get started, I really have to thank Mr. Nugent, head of Sientra, Blaine Hamilton, who's helping with all the technical aspect, and this would be impossible without him. Our partnership, the Aesthetic Society with Sientra, who stepped forward to make this work, and our panelists, who Mark will introduce. Plus, there have been a lot of people who've given input to how this should be done and what needs to be done, and all of the things that cover Tracy Pfeiffer, Mindy Hawes, Herlif Lund, Charlie Thorne, Bill Adams, Jamil Ahmad, part of our staff, Sue Dykema, Debbie Toombs, and Alicia, plus James Furneaux, Steve Teitelbaum, and Bob Aker. They put in a tremendous amount of work over the last few days, and you could see that the interest, we've had well over 1,000 people register for this. All of us are going through similar issues and have a multitude of concerns, and we hope to address many of those. Things change hour to hour. The best information we can give you at this time, the slides are probably our 15th or 20th iteration in the last 2 days as things continue to change. We plan to have a subsequent webinar, and we'll talk about that in time to be announced. We need plans based on valid data. Remember, 80% of COVID-19 cases are mild and can be ridden out at home. I will tell you, I spoke a couple days ago to Jamil Ahmad, who's part of the Education Commission and heads that with Bill Adams, and explained what we were doing and why this was necessary, and that nobody had really experienced things like this before. And Jamil, who's much younger, commented, "Well, Robert, tell us what it was like when you went through the influenza epidemic of 1918. I said, "Well, that one wasn't bad. Let me tell you what it's like going through the Black Plague."
All right.
So with that, I'm going to turn this over to Mark and Blaine, and we'll go from there.
Well, this is our second webinar. The first one about citywide lockdown, I think, was very successful. Beyond that, again, we're talking about the next phase of things. And so we're going to have a variety of presentations. Mary Jewell is going to talk about communicating with patients. Ryan Miller will talk about online options for communication and patient care. Mike Edwards, seeing patients in the office and reassurance. Renee Coover, who's our HR attorney, will be talking about personnel issues. Robert is going to talk about elective surgery. And then I'm going to talk about the financial impact of the pandemic. So that's where we're going to get started. Robert and I are co-moderators of this. Here's our bios and what we have been involved with over all the years for practice management at ASAPS. I think, again, this is a great opportunity to exchange information and hear some very insightful presentations. As far as the faculty, Mary Jewell, who's the practice manager of my practice, has taught practice management for the last 25 years and has published. Ryan Miller, Chief Executive Officer of Aetna Interactive, a wonderful web company that will be giving a very insightful presentation on patient communication electronically. Mike Edwards, past president of ASAPS, a member of the Nevada State Medical Board. Renee Coover, who's a previous general counsel for the American Med Spa Association, very knowledgeable in these areas. Again, many thanks to Blaine Hamilton, Technical Director, who's the Director of Medical Affairs and Professional Education at Sientra. And again, for everyone who's not faculty, please mute your microphones and stop your video. Now, we do have a chat function on the screen, which is in the menu bar down at the bottom. So if you do have questions, type them in. Blaine will look through them, and then we'll talk about it during the presentation. So I'd like to turn it over first to Mary Jewell, who's going to talk about communication with staff.
Well, good evening, everyone. Truly, there is a seismic shift underway that we are all facing. And it's up to us to determine how best to handle it. I want to talk to you tonight about employing something like continuous connection with your patients. There are newer technologies which you will hear about tonight, and they are going to help you understand how to keep in contact with your patients. And don't think that it's not going to be a number of reschedulings of surgery, and how do we do our follow-up visits, and can we do them remotely? Many of us have been doing virtual care access for an extended period of time, but this is going to be offered to you tonight. When you have continuous connection, you are responding to the patient's desire and then providing curated offerings, and I'll share ideas about that. You coach your patients as well as staff behavior, and then there is this automatic delivery. So let's go on to the next slide. People always come to you with the desire for, and this is a strategy that is something that we are going to have to look at, because we want to provide it seamlessly, but right now, as you can see from the expression on my face, it's not always that easy. You have to inform your patients about the government mandates. This is difficult, but it has to be explained. You need to provide flexibility, because health and safety is now the most prominent piece of the puzzle. You know, many of us have customers who like being in the driver's seat, and this is not going to be part of the reality of this pandemic because of the fact that we have to do things correctly. Now, what is a curated offering? Well, it's a personalized recommendation process. Some people do it in their office, some people do it virtually. But this works well for patients who really value advice, but still want to make the final decision with you. How you communicate, your physician and your staff are listening to a patient's needs, wants, and desires. And being a good listener instead of just telling them what they need is helpful to bring them along. The physician always examines the patients and then charts the best strategy, course of action, with the patient agreeing to the action. And then that approach gives the patient something that's a lot more gratifying than if they had just chosen it on their own or had been paying attention to just Dr. Google. In our staff meetings, we are known for stand-up staff meetings. In other words, we're doing it on the fly as need be. And we do well with this. These coached behaviors of not only the staff, but the patient are really important. The team effort not only involves the doctor and the patient, but the patient's caregiver, the nurses involved, in fact, your entire staff. So you want to provide information that gets shared regularly so that you don't miss that right moment to suggest an action for them. And this is also, like I said, with the patient's caregiver in the driver's seat with you. In fact, the other day when patients came in and we were testing the caregiver to say that they didn't have a temperature also, the patient's husband said, now I know I've got skin in the game. Anyway, there is an automatic delivery system with the newer technologies. They enable frequent, low friction, truly customized digital interactions. That also helps build deeper ties. If the patients are waiting to hear from you, they're going to find you on the websites, etc. And I promise you, Ryan Miller will teach you a lot more this evening. Our nurse does an awful lot of phone conversations with our patients on a regular basis, and that has been a helpful way of transferring information so things don't go awry. Next slide, please. So when recovery happens, and we know it's going to happen, how are we going to be set up to be ready? So if you can get information out, what I really want to say to you here is don't allow patients to feel that you've walked away. They want to hear from you. They want you to suggest action. Place patients on surgery schedules, for example, with the understanding that it may need to be changed depending upon the course of the pandemic. This kind of timely and personal connection that builds trust with your patients, and it also encourages your patients to think of you all as a health and fitness resource. That it keeps them motivated and they keep coming back for more. One of the other things I would like to share with you is I think it's also important that you communicate with your patients in a very good way what you're doing to help the safety of your community. Now here is one of our employees, and she is literally making masks for the hospital because they've run out. And you know, everybody has, when they saw that picture, given her, you know, the high five for her abilities. So stay personal with them as well.
So some questions and answer for Mary. Mary, patients that are having their surgery postponed, you put them on the schedule in the future. Does that give them some reassurance that they still have a spot?
Most definitely. I think that it also tells them that that surgery is important to the point that we will work around their schedules with their families, etc., so that they don't feel left out.
Mary, now a lot of offices have closed temporarily and the staffs are working from home. How do you maintain morale in that situation? How do you have office meetings? How do you communicate with them?
You know, Robert, we did that this morning. That's an excellent question. Not everybody came in, but all of our staff was online with us. And it went well. Nobody felt left out. And I think that's a very important ingredient. Thanks for bringing that up.
Yeah, we also used a WhatsApp platform where all of us, you know, can communicate there.
And that does help.
Yeah, putting
Mary?
together a WhatsApp or some common communication for all of your staff that they all get the message, I think works great. We'll probably hear more from Ryan about that. Now, you talked about patients rescheduling. Talk about your financial policy of a couple situations. One, you've electively taken them off because you've closed for a while. Two, they decide they don't want to reschedule. How do you deal with that? What would you suggest? And I know every office is going to be a little different.
Yeah.
These are not hard guidelines for anybody. We're just trying to give different information of ideas that all of you can take back to your own practice.
Okay, Robert, that's another great question. When we felt that Governor Brown in Oregon told Mark that he could not do any surgeries in our office, a lot of our patients had already paid in advance. And so what we chose to do is reschedule them if they wanted to. We have $1,000. I'm sure in many places it's more than that, but we have $1,000 when a person signs up that is non-refundable. This situation, we want to work with patients. We want to put them back on the schedule, but if it's not going to work, that $1,000 goes forward to another time. And in fact, if they end up not choosing to do this because of timing, they can use it in our medical spa. But for the most part, I will tell you, every single person so far has chosen to stay on the schedule. They know that they have the opportunity to look at, the fall, because summer's coming and everybody loves summer in Oregon because we don't see enough sunshine. So what I'm trying to say is it's been really good and the refunds have been minimal. But Mark also gave those people who were, the week they were told that they were going to have, or they were going to have surgery, that they couldn't have surgery. He said, when you sign back up, I'll give you a 15% discount. And they were like, hallelujah, thank you.
I've done, with some of the cases that we're on, that have electively canceled and set a potential time to reschedule them. I also said we would give them a value-added benefit of either, skincare or something like that to make them feel that we're doing something to go out of our way for their inconvenience. Michael, I'm sure you're facing the same situation. How have you handled this in your office?
Well, pretty much the way that Mary has done it, Mary and Mark, that is. One of the points I was going to make is that what we have found, and probably other practices are hearing the same, is we're getting phone calls from people who say, hey, I'm home, I want to have my surgery now. Mm-hmm. And so, and we're actually getting quite a few of these calls. It's a tough problem to have. And the point I wanted to make is that, and I think Mary mentioned it, is look at your staff, who's answering the phone, because they are doing that virtually nonstop to the course of the day. They're the ones that are representing you to your patients, and they're the ones that are having to, we've had very few patients that have been angry about this. They fully understand the need to postpone, and I can't think of anyone, I'm sure there are some, but I can't think of anyone that our staff has told us has given them grief. They're not happy that they can't come in and have surgery while they're on forced time off from work, but we've done basically the same things. We've every office is going to be different in terms of the money that you keep or not, whether you reschedule, but for the most part, just about everyone has accepted their reschedule date into the future. And they also know that depending upon what happens in the world, that may be pushed out even further. So it's just a matter of good understanding on both parts.
Our staff, not only our patients, but our staff have a lot of anxiety, concerns. What advice do you give them, Mary? Because you've been excellent with handling your staff.
Robert, that's another one. That's great. To be honest with you, your staff, as Mike just said, really truly represents you. So if they are anxious, I have spent a good time one-on-one with each of our staff members and ask them what they want to do, that I will work around their needs. And I think that has helped significantly. I have 3 people who are not coming in right now, and it was their choice. They have young people at home and they're happy to be doing that. And everybody else is pushing to get there and be helpful. And although we're really quiet as of this week. It'll be interesting to see how it ramps up.
We're
But
going
you
to get
need
to
talk with them.
I'm sorry. We're going to get to a lot more questions about handling staff and making decisions when Renee Coover talks to us.
Right.
I'm looking forward to that.
Thank you, Mary.
Thank you.
Thank you.
Okay, well, let's go on to the next presentation by Mike Edwards, talking about how to adjust to the prohibition of no surgery, but also how do you talk with patients that you do see to let them know you're making them safe? Michael.
Thanks, Mark, and everybody. It's always tough following Ryan. He gives such a great presentation. It's a lot of information. I was taking notes as he was speaking, as I always do. But I want to talk about a couple things that really affect you on your, or affect all of us on your day-to-day practice. And so let's just jump right in. So should you make changes in the flow of the patients through your office? And I think that the answer is sure. As has been said, in many states, there's a prohibition on elective surgery and anything that is non-urgent or non-emergent. And so that really shuts down quite a bit of what we do. We don't currently offer any Botox or fillers. We don't offer any skincare. And in our practice, we're seeing immediate post-ops, and that's just about the size of it. So most practices have closed their offices for another 30 to 40 days, depending on what their governor recommends. And there's always the federal guidelines as well. Do you limit or restrict the flow? And I think that it's really smart to have one entry point in your office where you can control who comes in and you can escort folks out. You really want to minimize the amount of time that they spend in your office. You want to minimize the time that they're in your lobby for the reasons that we all know about, limiting potential spread of the virus. And then for how long? At this point, it's about 4 weeks, and we've kind of set our practice up so that in mid-April, we counted down and have told our patients that we are closed until that time and that we are certainly available, but we are scheduling out past that point with the proviso that the patients know that they may get bumped out further depending upon what happens in the world and in our state. So are there best practices to keep your patients and staff safe? And so we've talked a lot about screening. We initially screen or recommend screening by phone to talk to them and just get the general questions. Have they been ill? Are they around anyone who's ill? Have they been out of the country internationally? And if so, you might ask them to wait. In fact, sometimes you might insist that they not come in for at least a self-imposed 14-day period to make sure that they're not infected or couldn't infect you or your staff. It's important to remember too that as you have this person screening in your office, that conjunctivitis and diarrhea are sometimes known as early signs of the COVID virus. So they need to be well aware. You can't just set a secretary, if you will, or a receptionist down there. You need to have somebody who has some knowledge base of what to do. Once the patient's given the all clear by their clearing or their screening, you can run kind of a concierge practice, if you will. They can call on their way there and sit tight in their car out in the parking lot. And once you have a room ready to see them, and I'm speaking at this point specifically about our early post-op patients, up until about the 6-week period when you feel like you can kind of push out their next follow-up a little bit further. But that way you can have them come in and they can be ushered right into an exam room where they can be seen by you, and then you can get them on their way so they can get home and take care of their other loved ones as well. Taking a temperature of somebody once you screen them is not a bad idea. Somebody with a temp over 100, it's probably best to encourage them to go home and take care of themselves ahead of time, but that's something that will vary from office to office. The next really hot topic is the personal protective equipment. There's no replacement for good hygiene. Hand washing, whether it be with soapy water for 30 minutes or 30 seconds, or an alcohol-based hand wash, avoiding touching your face. I'm trying really hard as I do this to make sure not reach up and touch my face. We've all seen the people in the news that are talking about this and they reach up and rub their eye or they lick their finger to turn the page. And so it's important to practice social distancing. And it's hard for me. I like to shake hands and give patients a hug. And it's really been tough going to an elbow bump But for right now, they always, you make a bit of a joke out of it, and they all seem to understand. Masks and gloves can be really helpful in the care of patients, especially if you're in close proximity. Let's say you did a rhinoplasty just before all this started, and you're trying to look inside, or maybe removing a splint or sutures, and you're getting close. So you really need to protect yourself like the anesthesiologists do if they're intubating somebody. So a good N95 mask, and I'll go over the other mask in just a minute, can be really helpful for you. Eye protection is also something that's important. If you follow the ophthalmology literature, there are a number of ophthalmologists who have gotten COVID by eye exams for a patient coming in with conjunctivitis. So that's something that you need to be aware of, and also to make your staff aware of. Regarding masks, is one mask as good as the other? I've learned more about masks in the past few weeks than I ever thought that I'd need to know. But basically, the masks that we all wear when we go in the operating rooms are not good for blocking the virus. I mean, any little bit of something helps, whether it be a cloth mask or a surgical mask, but really to block the small virus droplets, an N95 mask is what you need to have. And if you look online like I did today on YouTube, there are people that are showing how you can make a mask by going and getting a HEPA filter for your house, breaking it down, sewing it into a pattern. It's amazing the ingenuity that's going on out there. It's also amazing that we don't have the products in our pipeline, but that's for another discussion. It's also important to clean the room between patients. Wipe the doorknobs down, wipe the countertops down, wipe the bed down, wipe the light switches, anything that the patient may have touched, and that should be allowed to sit on the surfaces for at least a minute to have the full virucidal effect. Keep doors closed when you have a patient in the room. And then once they're out, allow the room to air out. You almost have to treat it like the person does have the virus, even though they have no symptoms whatsoever. Let's go to the next slide. So what do you do with your schedule? Some of this has been discussed by Mary and others. For your office schedule, are you going to see these post-op patients? So set a block aside so that your office knows when you're going to be available to see patients. If you decide that you want to do these telemedicine consults, set a time in your schedule that if somebody calls in and they choose to do that, you can have a 30-minute or a 45-minute or an hour time session set aside so you can dedicate that to that patient. The way I've chosen to do it is to have the patient send paperwork if we can ahead of time, but also I'm a big user of TouchMD, which has a method with which you can actually have the patient put their pictures on the TouchMD system by their HIPAA compliant manner. It comes up in your system. And then you can actually share screens using GoToMeeting and go over it just like you had an in-person consultation. So that's just one other way to do that. In terms of your office schedule or your operative schedule, we know what we're doing. We're not doing much of anything for at least the next 3.5 or 4 weeks, unless, God forbid, you have some kind of an emergency, and then you have to have some means of carrying that out, whether it be at a local ambulatory surgery center, or if you're fortunate enough to have your own operative room. But otherwise, we're not doing much operating for the next month or so. In terms of the staff schedule that was mentioned before, we have a skeleton crew in our office to answer the phones. We're still having packages delivered to keep the office running. And so we have a skeleton crew, and we also have somebody that's on call or standby should they need to come in and be a chaperone or to help with a procedure should that need to be. The other thing that Ryan talked about was how do we keep in touch with our patients, and he really covered all the bases. I think there are many different ways to do it. WhatsApp I didn't mention. Let's go back one slide. WhatsApp is actually a good method to be able to get a hold of your patients, but if you're tech savvy or have a good relationship with your web folks, the pop-up boxes that Ryan mentioned I think sound like they're very helpful. That was a note I took. You should always have somebody that's available on phone, just like you always do through your answering service for after hours and even during the daytime. All right, next slide. I think Ryan mentioned on some of this as well. What do you do with your downtime? We are always complaining to ourselves or others around us that you never have time to get this or that project done. I mean, maybe you need to update your web gallery on your photo gallery on your website. Maybe you do want to make those videos, those educational videos that you either post on your website or go into YouTube. Not very exciting or glamorous, but look at your policy and procedure manuals. And I think probably one of the more important things is take care of yourself and your family. These are really stressful times, but just remember those around you are just as stressed. So if you have young kids, make sure and spend time with your young kids. Time to reconnect, have a game or board game night. So take care of yourself. Exercise as much as you were doing before, maybe more. In terms of your office, it's a good time to do a deep clean. Really pull things out that weren't pulled out before. Go to or have your staff go to your supply room, pull stuff off the shelves, give it a good clean, and just use this time constructively. Talk about very clearly what you expect in terms of cleaning in between patients in the room. And what we've done is temporarily removed all the things that were in the offices or exam rooms that don't need to be there, whether it's the stack of implants or brochures, because those are things that the patients will touch when you're not in the room. And so just minimize the chance for that to occur. Next slide, please. So when you're seeing patients, how do you interact? As has been said, our patients look to us for reassurance. They look to us for advice, not just as their cosmetic or plastic surgeon, but to them, you're a learned physician who can give them common sense and advice. And as I said, reassurance. It's good to be informative, but talk to them on a level that they can understand. You know, they don't know all the ins and outs about the N95 mask and all these different things, but try to, if you'll pardon the term, dumb things down to a level that they can appreciate that you're trying to inform them, but make it so it's understandable. And they'll thank you for that. It's a really important part to take away. Care them for them as you would normally, and you can do virtual follow-ups using the same HIPAA compliant issues that we've talked about before. And lastly, what we've done in our office and many others as well, I'm sure, is see your patients in their early post-ops, but then stretch out those visits. Maybe you don't need to see that person at the 2-month visit or the 4-month visit, depending upon where they are. You can stay in touch with them by phone, but just make sure that you're protecting them as well as you and your staff to carry on. Thanks.
Well, thanks, Michael. There's a tremendous amount that's been covered already. The real essence a lot of people want to hear about are handling staff and legal issues. So we're going to cut short right now any additional questions so we can get through some of this. There will be questions at the end. Blaine, I'm going to ask you, if we run over an hour and a half, is that feasible technically with the platform you have? Because there seems to be a lot of interest, and I don't want to cut anybody off who has good questions.
No, we have no restrictions.
Okay, so we can
Right.
go and we can cover everything. Michael, then in that case, I'm going to ask you one question. I know that you've had experiences with patients walking in and walking out with some of your supplies, and I know I've talked to a physician at the VA say they're actually ripping the dispensers off the wall. Tell us how you deal with that, and also the fact that, you know, how do you limit your staff walking out with some critical things?
Yeah, it's unfortunate but true. What we did at the outset was we have a large office for plastic surgeons and dermatologists, so it's a big square footage space. And so the staff went around and kind of collected things up, the hand washes, the cavity wipes and all those things, and they're put on a rolling cart. And at the end of the given day, they are rolled into a room that's locked and protects it from housekeeping. Same thing, unfortunately, we don't have many masks in our office, but those are all locked up because you have to protect your sources or resources, I should say. I haven't had any patients walk out, but I'm sure that over the years, implants do make their way into purses and head out the door, but haven't seen anybody that's taken the hand wipes or cavity wipes just yet.
Thanks.